G'day. This video today is going to talk about interpreting in a public hospital environment. When you attend a public hospital, regardless of where it is in Australia, any public hospital, the onus is on them to provide and book an interpreter for you. Having said that, each individual state has different protocols and different guidelines when it comes to booking interpreters, which can lead to some confusion because some states will use their preferred interpreter booking organisation. Hypothetically, if you were to attend a hospital and have issues communicating and even trying to express yourself that you'd like to book an interpreter, we understand can be quite difficult. We've developed a card that you can download onto your phone. So when you present to a hospital, you can show them the card and hopefully they will then book the interpreter for you. We'll show you in a moment what these cards look like for each individual state. Queensland will have their own card. New South Wales has their own card. Victoria will have one, and so on and so on. I will show you very soon what the actual card looks like. If they say that they've booked an interpreter, and yet you've been waiting quite some time and are unsure about what is going on, you can actually directly contact Auslan Connections. We operate on a 24-hour, 7-day-a-week basis to book interpreters for you, the deaf community. So Tasmania Health Service will book Auslan interpreters for all the public hospitals in Tasmania. If you were to go into a hospital and ask them to book an interpreter, a staff member should then contact the Interpreting Services Agency. Is based at the Royal Hobart Hospital. That is where the list of interpreting services that are utilised is based. And Auslan Connections is one of those preferred providers for interpreting services in Tasmania in the public hospitals. If a client or a staff member at the hospital needed more information or needed to have a deeper conversation, they can contact Auslan Connections directly. The Victorian public hospital system is called Health Share Victoria, and they look after the various interpreting agencies on their books. One of those interpreting agencies is Auslan Connections. Auslan Connections is an approved provider of interpreting services. There is no commitment, though, on part of the hospital to book through Auslan Connections. It is up to the hospital to choose their various agencies that they would like to book through. In Queensland, there are different interpreting agencies. Queensland hospitals have the prerogative to choose their preferred language service provider. Auslan Connections is the preferred language service provider for all of the Queensland public hospitals. If you were to present to a hospital and wanted to book an interpreter, you could show them this card. The hospital will then know who to call to book an interpreter. And that agency would be Auslan Connections. In New South Wales, they've used the Deaf Society interpreting brand. So some people might get a misunderstanding as to why the cards are different. It's because the names are different. So the New South Wales use Healthcare Services, HCIS, Healthcare Interpreting Services. If the interpreters were unavailable, they would then book through Auslan Connections. Some of the local government areas, the LGAs, based in New South Wales, will use us as their preferred organisation because of the relationship we've established with them. If you were to go to a hospital and wanted to book an interpreter, show them this card. They will either book the HCIS interpreting service or the Deaf Society. The ACT they've used the same name, which is the Deaf Society Interpreting Service. You might be saying that the card is different than the other states. That's because the branding is different. Here, the ACT public hospitals don't have a centralised system for booking interpreters. But if you were to attend a hospital and showed them this card, they would know to book through us. They would either provide an interpreter on site or a video remote interpreter. In the Northern Territory, there is no centralised system when it comes to booking interpreters on behalf of the hospitals. So for now, each hospital manages and pays for their own interpreting services. If you were to go to a hospital, you would show them this card that you've downloaded. The hospital would then know to ring and make arrangements to book an interpreter, and they will look for a local interpreter. If none are available, they would then book a video remote interpreter.